Hello everyone, how you guys doing today? It's me, Dr. Orlando Walters. I really want to discuss, here's what happens when you have a weak core. So when you have a weak core, initially it's not really an issue. But as time goes on, you have insidious issues that occur. So initially you might start off with a little bit of pain, a little bit of a lack of motion, maybe in some cases, increased motion. You will also, when time progresses, it's going to have disc pain or pain in general, potential disc herniations, stenosis, sacroiliac joint pain, sacroiliac joint rotation. As really progresses, spondylosis, spondylolisthesis, retrolisthesis, which is really the spine kind of shifting out of place and holding that place and maintaining it in a bad position. And when the possibility gets more severe, you're going to have pain or issues or injuries in the extremities. And when there's also neurological symptoms that occur because of the weak core, resulting in aggravation to the nerves, you have radiculopathy or nerve pain that goes into the buttocks, or if it's in the upper area or in the cervical spine, nerve pain that occurs in the shoulders or the arms. As far down into the fingers, you might have some tingling. You could also potentially have atrophy of muscles in the involved areas or sections. So these are things that happen when your core is weak. It progresses into a bad situation. So to piggyback on what happens when you have a weak core, now we're going to discuss what typically happens when you have the residuals of that weak core. So because of the pain, most of individuals, they tend to do nothing about it initially until it gets really bad. And after that, you tend to go to your doctor. The doctor issues you medication, which usually masks the pain or the issue to begin with. Sometimes individuals tend to go and get massages or interventions like that. And there's nothing wrong with that. However, they tend to mask the initial injury to begin with, or the initial problem. So you really want to make sure you address the issue as quickly as possible, which is typically the best case scenario. A lot of things that you do on a regular basis, loss of strength, loss of function, worst case scenario, individuals with pain for a long period of time, they're depressed because they can't see the light at the end of the tunnel. So quite frequently they're not sent out to movement specialists such as myself as a physical therapist or exercise physiologist, depending on severity. And sometimes that is the best case scenario for a movement related issue right away. So we definitely want to make sure that we don't go the traditional route, which is pump you full of medication and give you injections. We want to make sure that you understand, or give us the opportunity to help you understand what the true problem or the source of the pain is. If we can help you as a physical therapist, then we'll do so. If not, we also have the capability to refer you to the best individuals for your particular case or scenario. So we are not all-encompassing as other professions might like to lead individuals to believe. For individuals who have had the pain for long periods of time, more than likely, especially when it's been lingering for a long period of time, you're going to have a loss of quality of life. Now, this loss of quality of life can manifest itself in quite a few ways. It could be a result of limitation of pain. It could be a result in individuals not having the opportunity to perform what they typically do. So if you're an active individual, you like to play sports, you like to play basketball, you like to golf, that pain might limit you from doing so. Or maybe you like to play with your grandkids, or like to garden on the weekends. Because of the pain, the lower back, as a result of the weak core, you can't get down and do those things that you truly like to do. As a result, the quality of life has diminished significantly. With that loss in quality of life, potentially you have the chance of falling into depression. And the reason for that is because you have difficulty seeing the light at the end of the tunnel, because you've had the pain for so long and you feel as if it is progressively worsening. So quality of life is definitely an issue when it comes to having an individual rehab or come back from an injury that they had initially. Here's what you should do, and that is seeking the advice of a knowledgeable professional or specialist in the respective field. Reason for that is, with this knowledge, the individual should be able to figure out what is the source of your injury or your pain to begin with. Now, if you understand the source of your injury or pain, then we, for lack of a better word, can reverse engineer the problem so that we can solve the issue. If we're able to solve the issue, you should have long-lasting results in terms of reduction in pain, increased mobility, increased function, increased strength, and so on and so forth. So that comes with knowledge of individuals. So I firmly believe that your healthcare provider in his respective field should be able to explain and educate you as the patient or client in exactly what's going on and how to recover from that. And if they can't educate you, chances are they probably aren't well versed in the issue to begin with. You're just probably going through a typical protocol. And generally speaking, there's nothing wrong with that. However, if you have a case that does not fit into that protocol, and you don't have somebody who can problem solve and be able to manipulate the situation to benefit you in your unique issue, then you're going to have a longer road of recovery ahead. So complete understanding is very important. So this complete understanding could occur from your doctor, your physical therapist, or your specialist, or potentially a combination of all three. So healing is all encompassing. One thing that we want to make sure is that your healthcare professional also teaches you how to heal yourself. Best case scenario is, if you know how to heal yourself, or you're given the right knowledge, ultimately you wouldn't have to seek the advice of the professional any longer. So that is the perfect case scenario. And ultimately the way of practice is that when I see you, my job is to get you fixed as quick as possible so I never have to see you ever again. Not because I don't like you. The primary reason is, if I want to get a job done, the job has to be complete. And the only way to determine if the job is complete is if you never have to have someone come back to fix or readjust the problem that's ultimately there. Now that is the perfect case scenario, very similar to hitting a grand slam on your first pitch. However, you definitely need to have a goal to shoot for. So again, definitely want to make sure individuals reach their highest quality of life and able to heal themselves based on the knowledge and the expertise which have been given down to them from their healthcare professional based on their knowledge. And that is the best case scenario. So if you guys have any questions or any inquiries, always feel free to ask. We will give you tips and pointers on how to help and heal yourself. And we'll go from there. You guys have a great day.